Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, November 4th. We are joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. We are also joined as usual by our sign language interpreter, Mary Thiessen, and André Boursier from French Language Services Directorate. Following our speakers, we will go to the phone lines for questions from reporters and from reporters in the room. We will call you by name and you will each have 2 questions. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@gov.yk.ca. Premier Silver.
Thank you very much, Pat. Thank you everyone for joining us here today on the traditional territory of the Kwamandun First Nation and the Ta'anquachin Council. Our government continues to manage the impacts of COVID-19 based upon the recommendations of the Chief Medical Officer and his team. We have no new cases to report here in the Yukon, and I am pleased to share that 20 of our 23 cases have now recovered. As we move into the 8th month of this pandemic and winter firmly setting in, it is important that we continue to support each other and to take precautions to keep our territory safe and healthy. Last week, we did lay 2 new charges under the Civil Emergency Measures Act, both for failure to self-isolate. I cannot stress how important it is to self-isolate as required. It's not a suggestion, and it's not something you can choose to ignore if it is inconvenient. The self-isolating requirements are in place to prevent the spread of COVID-19 in our territory. When you fail to self-isolate, you put your friends, your neighbors, your colleagues, and fellow Yukoners at risk. We have had a low case count in the Yukon so far due to the great efforts of Yukoners. But we are not out of the woods yet. We still absolutely need to stay vigilant. I know there is a lot of COVID-19 fatigue out there. Seasonal events like Thanksgiving, Halloween, Remembrance Day, Christmas coming up, these are all usually times of gathering and connecting with people, but we're not living in usual times, and we do absolutely need to stay mindful of this. We're counting on you. It's especially important to continue to take precautions as we spend more time indoors. Now, the best way to stay in touch with your friends and loved ones is by connecting online, over the phone, or in person at a safe distance, 1 caribou apart. It's still important to stay connected, absolutely, and to check in on one another as we continue to navigate these extremely challenging times. We are absolutely all in this together, and together we will get through this. As you know, on October the 30th, Yukon's Chief Medical Officer of Health confirmed the first death in our territory related to COVID-19. This was one of the 5 people diagnosed with COVID-19 in Watson Lake late last month. While the individual was an older Yukoner with underlying medical conditions, the very short time from when they contracted COVID-19 until their absolutely unfortunate passing should give us all pause. Our colleagues and I are extremely saddened by the loss, and we send our condolences to friends and family of the deceased. We are all holding the community of Watson Lake in our hearts, and we're sending our love and our supports to the entire community during this very, very difficult time. Now more than ever, it is so important for communities to come together and to support each other as we continue to navigate through the pandemic. I want to take this time to thank the healthcare workers in Watson Lake and across the territory for their extremely incredible work to support Yukoners. From nurses and doctors, the Chief Medical Officer of Health and his team, folks doing extremely important work of contract tracing with Yukon Communicable Disease Control, those who are answering the calls through 811 and working with the COVID testing and assessment center, the Whitehorse General Hospital, the community hospitals in Watson Lake and in Dawson City, and the healthcare centers in our rural communities. I can't stress it enough. Your work is so essential. It's essential to the health and safety of Yukoners, and I want to express my deep gratitude for all that you continue to do as we manage through this pandemic. I also want to thank those who are helping administer flu shots this year, including the pharmacists who are providing flu shots for the first time in our territory. And I also want to thank Yukoners for all of your sacrifices that you've made and continue, your continued efforts to minimize the spread of COVID-19 and to keep our territory healthy and safe. Thank you for your efforts. And please, continue to be vigilant and taking the recommended precautions to keep yourself and your community and all Yukoners safe. The Chief Medical Officer of Health has confirmed that the risk to the communities remains low. Nevertheless, we all have a role to play to ensure that we minimize the impacts of this pandemic in our territory. Our risks are low because of your actions. We must continue to be vigilant in our collective work to slow the spread of COVID-19. Be kind, be patient, be respectful of each other, please. And make sure to practice the Safe Six. Wash your hands, maintain physical distancing, stay at home if you're sick, travel respectfully and responsibly, self-isolate when required, as required, and follow the gathering guidelines, including limiting indoor social gatherings to 10 people if they are not in your bubble. Once again, on behalf of all Yukoners, I send my deepest condolences to the families and the friends of the deceased. I can't imagine what you're going through in these troubling times. We stand together in your sadness at this time. Masicho, thank you very much.
Thank you, Premier Silver. Good morning. Bonjour tout le monde. Last Friday, as the Premier said, we announced our first death in the territory. And that's still less than a week ago. And I want to echo the Premier's sentiments that we're all still grieving with the family and with the town of Watson Lake. As devastating as this news was for all of us, life, elections, the pandemic, and daily activities all keep moving on as they should. This was a moment in time that tested our resilience as Yukoners and should give us pause to consider whether, as a population, we are doing everything we can, both to minimize the consequences of COVID in our territory, as well as to maximize our ability to thrive over this winter period. And more on that later. First, though, a brief update on where we are with that outbreak. As the Premier said, our numbers do remain overall at 5 cases in that cluster, and all other tests to date have come back negative. We can be confident that there is no added risk of COVID transmission within the community. We've conducted all the necessary tracing, contact tracing and testing. We will continue to investigate the source of the origin to determine how these individuals came into contact with COVID-19. However, we do need to be ready not to find a result. In conclusion, we've identified no further spread. We're confident that the outbreak is contained and that there's no evidence of community transmission of COVID either in Watson Lake or elsewhere in Yukon. Although we are in a fortunate place as a territory, the recent Watson Lake events, I think, have helped put things into perspective for us. We need to be aware of how quickly COVID can come into our lives. We can go from the current state of a few to no active cases to a surge of activity and spread in one or more areas of Yukon. COVID is an opportunist, looking for a way to enter and then a way to spread. We must avoid giving it any opportunity to take hold and to spread. And how do we do that? We all know, of course, by following the Safe Six rules. We could easily hold 10 major gatherings and see no consequences and think we have licked this virus. And then that we could do it again. We got away with it. Why not another time? It's easy to be seduced by chance and good fortune and the randomness of spreading events. 10 times we may be lucky, but it might be the 11th time that we get into trouble. Trouble that we've seen in interior BC, in northern Saskatchewan, in many areas of Manitoba, in Newfoundland, many places in Ontario and Quebec and Alberta. Prevention is for certain our best medicine against COVID, and we know how to prevent it. So the Safe Six one more time. Maintain physical distancing, keeping 2 meters away from everyone who's not a member of your social bubble. Wash your hands frequently with soap and water, or use hand sanitizer with at least 60% alcohol. Stay home if you're feeling sick. Follow the social and the organized gathering guidelines and respect the limitations on group size. Limit travel to rural communities and be respectful when you're there. Self-isolate or quarantine if you've returned to Yukon and have been outside of our bubble in the last 14 days, or if you've been in contact with someone diagnosed with COVID-19. As Yukoners, we know how to live the winter. We need to get our share of outdoor activities, and all our gatherings over winter should be careful, small, planned, and deliberate. Remember the numbers for social gatherings: 10 indoors and preferably sticking to your household and social bubble, 50 outdoors and always spaced. For formal or organized seated gatherings, we have guidelines, and I encourage you to refer to those. It's in our best interest and in our community's interest to follow Safe Six and ensure that we're taking the necessary precautions to protect ourselves and our loved ones. When we let our guard down, COVID will enter quietly and, before we know it, explode into an outbreak. We need to continue to avoid that possibility. And while I'm at it, here are 6 further tips of how to be. Be wise, be careful, be safe, be vigilant, be aware, and above all, be kind. As COVID continues, we see our fellow Canadians coping with large spikes in cases. As people returned to work and public areas throughout Canada and started to gather more, cases increased. Similarly, I think we all realize that Watson Lake is not the end of COVID in our territory, and I'll continue to remind Yukoners that we need to prepare to see new cases within the territory. Like our counterparts throughout the country and the world, the risk remains for the coming months. At the same time, throughout the last 8 months, we've become more and more familiar with COVID as we continue to move forward. Therefore, we have learned not to panic or get too upset when a new case is confirmed. In the spirit of focusing on risk rather than simply case numbers, we will be changing our reporting processes. Rather than relying on a press release or a press conference following a new confirmed case, I ask that you continue to check the yukon.ca COVID-19 page. Following any new confirmations, our case count will be updated. In turn, we will release further information during our weekly press conference, unless urgent. If there is a notice of particular importance, such as a public exposure or a concern of community spread, we will release advisories and hold press conferences as required. However, in the event of a new confirmed case when there is no public risk, we ask that you be patient and wait until further details are discussed, as appropriate, at the weekly press conference. As always at this time of year, I've been seeing red poppies on many winter jackets and other apparel, and it's with pride and warmth that I witness the support for our veterans as Remembrance Day is quickly approaching. A day that's usually marked by a ceremony at the Canada Game Centre in Whitehorse and likewise in community centres throughout the territory, but it will look slightly different this year. Public events will not be held because of the gathering guidelines. Large events will be replaced with alternative options to remember veterans and soldiers. So do showcase your support by buying a poppy, donating to the Legion, attending one of the many virtual events held across the country, and bow your head, of course, in a moment of silence on November 11th at 11 a.m. COVID will not stop us from remembering those who have made their sacrifices for the country, but it has altered the way that we commemorate. If you're looking for alternative ways to pay respect to our veterans and our soldiers, I encourage you to reach out to the local Legion. And that's all for my update. Thank you. Take care of each other. Stay well. Merci, Joe. Merci.
Thank you, Dr. Hanley. Thank you, Premier Silver. We'll now go to the reporters, and we'll start with John from CKRW in the room. No questions. Thank you. We'll go next to Chuck from the Whitehorse Star.
Thank you. Good morning. I have a bit of an odd question for Dr. Hanley. We've been told here at the Star, or asked here at the Star, about whether sewage systems, community sewage systems, are being tested to detect any sign of COVID. I guess that wouldn't be very conclusive in Watson Lake or in Whitehorse. But I understand in other areas, or people are saying that if you test the sewage treatment system and you can detect the presence of COVID, maybe in a community where there's been no cases reported, but there may be some asymptomatic cases. Dr. Hanley, can you maybe shine some light on that?
Sure. It might sound like an odd question, but it's a great question. And it's called wastewater surveillance. And it is something that is being looked at various locations in the country. And it adds an additional piece of information about early warning surveillance. Northwest Territories, as you may have heard, have been looking into this, and they are piloting and have launched this project, or they are certainly getting close to launching this project if they haven't officially as yet. So that it is also something that we are learning from our colleagues in Northwest Territories, as well as a public health agency, and looking at that possibility for us too, as an additional tool, again, in looking at our overall strategy of detecting transmission, detecting spread. As with anything, it takes its own. It takes time. It takes time to figure out how it would be done, where it fits in our overall strategy, what the logistics would be, what are the limitations. So lots and lots of questions still to be answered. It's still early and new technology, and it may provide again an additional tool for us. So it's something that we are looking at. I can't say for sure whether it's something we will implement or not. We again have to compare it to lots of other priorities. But it does offer some potential.
Chuck, do you have a follow-up question? Chuck? Okay, we'll move to Haley at the Yukon News.
Hi, thank you. I guess my first question was the changing of the reporting process. Could I just get the rationale for why that's being changed, that releases wouldn't be sent out, but they can be looked up on the website?
Yeah, certainly. I think there are a couple of aspects to this. One is that as I said, I think it's really important for us to communicate risk and to let risk be the focus of our communications, and not necessarily case counts. So when there is a case, a new case, but it's contained and we have no concerns about it, we will of course add that once that's confirmed to our case count. but every time we do a press release or a press briefing, of course, that takes diversion from other important work that we're doing. And as always, we have to try to focus on what are the priorities. The real priority for communication, as I say, is giving the public the latest information about risk, and that includes such things as, is there COVID circulating in the community? Is there an exposure? The numbers themselves don't change that risk if they're not in that category of adding to public exposure. So I think it's just to be more efficient in our reporting processes, to maintain transparency and accountability, but also really to focus on where we really need to communicate and where additional information is really more supplementary.
Thank you. Follow-up question, Haley?
Yeah, I guess my follow-up, I mean, I hear that rationale, but it's obviously information that people are very interested in. Isn't that part of the role of public health to be transparent about that information? I mean, is there a concern that there'll be sort of less trust when the information is being put out quickly through press releases rather than just posted online?
The posting of information is our effort to be as transparent as possible and to be as nimble as possible in turning around information. Once we have processed, investigated, and are comfortable with the level of information, then that's the information we will provide. I think the interface really that we're continually trying to promote is information that's posted and information on the website, but not every case requires a media briefing.
Thank you. We'll move now to Heine, Canadian Press.
This is Chuck Tobin-Path. I did have a follow-up. Can I quickly ask it?
Chuck, can you let us run through and we'll come back to you, please?
Yeah, roger that.
Thank you. We'll move now to Canadian Press.
Hi.
Hi. Please go ahead.
Hi. This is Hina from the Canadian Press. I was wondering if Dr. Hanley could talk a little bit about this new information that's coming out saying those who get their flu shots have a better chance at having some kind of protection from COVID.
I just want to clarify your question. Your question was whether people who have the flu shot have better protection against COVID. Is that it? Yeah. So there is some literature, I think it's pretty scanty, that suggests that if you were to have both infections at the same time, both influenza and COVID-19 infection, that you might be worse off. And of course that intuitively makes sense. If you have two viral infections, either of which can potentially be serious, even overwhelming for people with underlying medical conditions, then you could have a worse outcome. And there is some at least preliminary literature suggesting that the case experience with that is actually pretty low, because since we've had active COVID circulation in a country, in the world, in those areas where we've had COVID circulating and public health measures in place, influenza circulation tends to have been very low. So we don't have a lot of actual kind of real experience with co-infections with influenza and COVID-19. The reason, of course, that we're promoting the influenza vaccine, and the uptake, by the way, has been really good so far in Yukon. And I'd continue to encourage people to get their flu shots at all of those locations. But the reason that we're promoting particularly the influenza vaccine this year is, one, for that reason, that we, at an individual level, we want to ensure people do not have that opportunity to have both infections at once. But it's also at a population level where we want to make sure that influenza has a low chance of circulating or being a significant hazard for us. The less viral illness in general we have in the community, the better we can focus on COVID should it occur in our community, COVID prevention, but also COVID management. And certainly in areas which are seeing community spread of COVID and even having their hospitals start to fill with patients and ICUs, it's a big worry if you were to see influenza at the same time. So really that's we really want to minimize the risk of influenza introduction and transmission in the territory this year in particular, and of course particularly over these winter months.
Do you have a follow-up question, Hina?
So you were saying that there's not much literature on it. There's it's just starting to be researched. I guess that's what I'm trying to understand about what actually that research says. Why is it that people who get a flu shot have a better chance at being protected from COVID?
Yeah, if there's literature that says people who have a flu shot have a better chance of being protected against COVID, then I'm not familiar with that. So I would have to I have not seen literature to say that. So I want to be careful about making any kind of potentially misleading communication. Really, the reason we're promoting flu shots again is to prevent influenza. I can't see any reason why an influenza vaccine would actually protect against coronavirus, given that the immunology is so different. But I'm certainly interested to look and see what's out there.
Thank you. We'll move to Claudiane, Radio-Canada.
Yeah, for the Premier, wondering if your reluctance, reported reluctance recently to allow, or not that it's your decision, I understand that, but your reluctance in seeing Alaskans travel through the Yukon south has something to do with the cases in Weston Lake?
No.
Do you have a follow-up, Claudiane?
I'm sorry, I didn't hear the answer.
Oh, sorry, Claudia. No, absolutely not. They're not related.
Okay, you can't elaborate on that. I'm asking because at the beginning of this pandemic,
Yeah.
you guys said that there was a lot of talk with the neighboring jurisdictions, whether it was Alaska or NWT, in knowing whether the cases or people coming through, if there was any cases that were developing once they were in their home jurisdiction, that we'd be able to follow through or follow up or have an idea. And I'm wondering if that works.
Yeah, I mean, so with our current provisions as far as travel through the territory for folks that are heading to either Alaska or through to the Northwest Territories, you know, our follow-through traffic, it's a lot of the numbers of traffic, but we've done a very good job of monitoring that. Minister Stryker has done extraordinary work with the federal government, with the decals, you know, to really help people to know if vehicles are safe, if they're from out of territory, that type of thing. And you know, we've managed to do very well with the current guidelines. When it comes to the Alaskan snowbirds, we support the current federal restrictions. It's just that simple on international travel. We do not consider it essential travel to head south for the winter. And we will continue to work with the Canadian Border Services, that agency, to discuss issues and address concerns as they come through. But the good work that has been done to allow for successful travel through to Alaska in regular circumstances under the guidelines that are provided is one thing. A request for this particular type of travel to be considered essential is something that we just disagree with.
Thank you. A follow-up, Claudiane?
It's okay, thanks.
Thank you. We'll move to Marine, L'Aurore Boréale.
Oui, merci. C'est une question pour M. Silver. Je voudrais savoir si la décision de diminuer les programmes de repas pour les personnes qui ne sont pas au Center of Hope, est-ce que c'est une décision qui a un lien avec la COVID, pardon?
So the question is for the Premier. Are the decisions about the meals at the Center of Hope have a relationship with the COVID pandemic?
Well, yeah. I mean, it has to do with the guidelines about safe distancing, physical distancing. What we see is the department working with other NGOs and the Whitehorse Emergency Shelter to come up with provisions to make sure that nobody gets turned around. And they've been working on that throughout the pandemic. You know, it was easier to get some boxed lunches when the weather wasn't so was better. Right now, the weather is getting worse. So to say that it's related to COVID, well, it'd be related to the guidelines and making sure that the folks that are in the Whitehorse Emergency Shelter and all of our facilities, for that matter, are safe, and the programs and services that are developed through all of our partner organizations and buildings can accommodate people safely as we provide those programs and services. I hope that answers your question.
Avez-vous une autre question, Marine?
Est-ce que cela veut dire que les personnes vulnérables qui fréquentent le centre et leurs familles devraient prendre plus de précautions?
Does it mean that the people that are vulnerable and their family should take more precautions?
That's a good question. I believe that the folks at the Whitehorse Emergency Shelter have been doing an extraordinary job of staying within the guidelines of people inside. I think the bigger issue is, well, of course, we would ask everybody that is accessing services to be as safe as they can and to adhere to the Safe 6. But I also believe that the staff has done an extraordinary job to work within the provisions of those guidelines. It's just that we're getting in towards winter, and it was easier to see a lot more flow through for people that had the ability to go and take their lunch and to eat somewhere outdoors. That's just not an option now as much as it was in the past. So a real heartfelt thank you to the staff at the Whitehorse Emergency Shelter, but also to all of the NGOs that are helping us with folks that are in need at this time through Health and Social Services and through the NGOs. We have a really caring community here, and I know that they take the safety of the clients extremely, it's extremely important to them. They take it very seriously. But again, anybody who's accessing these services, we've been making a big request today to everybody that we must continue to be vigilant. That's the biggest message today. And, you know, there's both myself and Dr. Hanley went through the Safe 6 again together in both of our speeches. There's a reason for that. We really want everybody, whether you're accessing social services or just on your regular weekends, as making sure that you are maintaining the vigilance, because your actions are going to help keep everybody safe. It's not just about you as an individual; it's about your actions, making sure that you keep our most vulnerable people, people with immune compromised diseases, these types of things, our elderly, safe. So again, be vigilant, and everybody practice a Safe 6, please.
Thank you, Premier Silver. We'll go back now to Chuck. Your next question, Chuck?
Yes, thank you. Sorry, I'm here. I was asking my question, but I forgot to take my phone off mute. That's why you couldn't hear me. Dr. Hanley, I was just wondering, what is the risk or likelihood of having an asymptomatic case in one of the communities and going undetected?
Yeah, thanks for that question. There is always a risk of that, but that's the reason for doing the type of testing that we do. So the risk becomes the risk of a random asymptomatic case being present when there's no other signal of infection is low. And so that's the reason that we are encouraging the testing that we do of people with symptoms, a wide variety of symptoms, and with even mild symptoms. And so that's, as you know, one of the things that we emphasize is that symptoms do not have to be severe in order to meet criteria to be tested. So by maintaining that low threshold for testing, even in people with no travel history, no known exposure, that's our detection. That's kind of our radar for detecting signals of otherwise undetected transmission of COVID within the community. But we have numerous other methods of doing surveillance. So we follow emergency visits at the Whitehorse Hospital as well as the other two hospitals. We follow calls to 811. We maintain that kind of surveillance of overall respiratory illness and respiratory presentation. So we're looking for signals in a number of different areas, as well as managing the cases that pop up as detected, in the emergency department or in the CTEC. So that means, therefore, that yes, that chance is always there. But we're actively looking for signals, and that helps us give that assurance that the likelihood of that happening is sort of just on its own with no other signals of disease is pretty low.
Thank you. I'd like to thank everyone for their time today. Our next COVID-19 update will take place on Tuesday, November 10th at 9 a.m. The time and date have been changed in recognition of the Remembrance Day holiday on Wednesday, November 11th. That's Tuesday, November 10th at 9 a.m.